Hi, this is Mrs. Lewicki, and this is part one of 3 voiceover PowerPoints on prioritizing care. Um, why is it important for you to prioritize care? Um, when you're looking at a number of patients that you're going to take care of, um, it's part of time management is to be able to prioritize care. But as you probably know, there are different levels of critical elements, and we'll talk about that throughout this presentation. But we really want to give priority or give attention to those things that require more attention or are higher priority than the competing alternatives. It helps the nurse to manage their time rather, and it helps to establish order. Setting priorities is a critical thinking skill. We do test you on this as well. Which patient would you see first? What's your highest priority of the items listed below? Things like that. But you should set your priorities according to the importance of the task. High priority interventions get completed first, and we'll talk about some of that. How do you know what to prioritize? There are qualities that impact a client's view of nursing care. Doing the right things is part of our effectiveness, while doing things right is part of efficiency. So those are things that patients and their families look at is how you are as a nurse. Is are you effective and are you efficient? Nurses need to be sure to limit distractions and interruptions and treat all clients or patients with respect and dignity. We want to observe for cues about staff emotions, and that goes back to earlier things that we discussed about being able to separate yourself from what's going on with the situation, but also if there's any staff interactions that are happening. Make quick safety checks of clients, and that is what we want to do regularly. Become aware of clients at risk. There are patients that we'll keep a closer eye on than others. Make note of time constraints on routine responsibilities. What that means is that every morning I give medications, and there are specific times that they have to be given, and we have a half-hour leeway of time. Additionally, if I'm giving a patient insulin, I need to give that within so many minutes of their getting their food tray. So those are also play into my ability to prioritize. Know how many and what level of nursing staff is available for delegation of tasks. You want to know what resources are available to you, both human resources and other resources, what the client prefers, and that does take time to allow for client preferences, and always look at what's the most important, which are the ABCs, airway, breathing, and circulation. I want to cluster assessment data to identify nursing diagnoses, select interventions to achieve the best outcomes, and I'm going to use Maslow's hierarchy of needs to do that. Maslow's hierarchy, you would have learned, and I don't remember psychology or sociology in one of those classes. And remember that it's a triangle or a pyramid, and that the highest priority items are on the bottom level. And what does that mean? That means that I need to meet basic needs like pain management, oxygen, keep them warm and dry before I can talk to them about smoking cessation or diet management. So again, it organizes the client needs, and needs motivate behaviors. Highest priorities are at the bottom. And when you're looking at what needs to be managed first, if there's a safety issue or a bottom level of Maslow's hierarchy that's listed or that you're concerned about with a patient, then that is a higher priority need. Think critically about order of resolving problems. That was one of my children that just walked by in the background. I can't tell which one. And then anything that's a low priority, your UAP can help you with these. Medium priority would include things like unhealthy physical or emotional consequences, and high priority are life-threatening needs.